abuse, neglect, and exploitation. And the result is too many people just were not understanding or seeing that what was really going on. People had individual glimpses of what's going on, but they didn't go beyond that. Now, in my case, my dad's body laid in his room for 7 days before anybody discovered him. That happened to be exactly the time I was out of the country for that week. So I wasn't able to make my calls and check in on him. His newspapers were piling up outside his door. A neighbor across the hallway came and asked them, I haven't seen him, will you check on him? And she was told, don't worry about it, it's fine, everything's okay. Well, that's not how it was. When the day I came back, the day that his body was discovered, they not only did they not acknowledge their role in not seeing a problem here, when my brother and sister were able to get to the facility first, and all they did was handed over a sheet of paper and said, you need to get your dad's room cleaned out by the end of the month. And needless to say, that was not easily done. We had to hire a hazmat team to come in and do that. Now, I tell you that just to give you a feel for how horrific some of these situations are. And it really, so when I started to look to see what, I thought, well, there's got to be some way that accountability can be achieved here. But when I looked, there really wasn't anything. So that, then I started to learn more and talk to more people. And that's when I really started to understand the full scope of what was happening too often. There were amputations from untreated wounds. In the cruel physical and mental abuse, people being slapped and humiliated and tortured, and sometimes. And these facilities have always been understaffed, which then just leads to neglect that has left so many people suffering needlessly. And then because of our opioid epidemic, we've got it's a target for people with addiction problems who enter a facility because there's such ready access to these drugs. Well, that leaves those residents without usually very important pain medication, suffering even more. And those with any kind of dementia or Alzheimer's didn't have an ability to communicate their pain even. So they were such an easy target. Unbelievably, sexual assault happens way too often. And we just need again, it's their vulnerability to these some people who are really sick in their own regard, but it's obviously just horrendous for the resident and their families. And then, like in my dad's, and some have been left for weeks, without being checked. So it really is a terrible situation. So as a result, what we've seen is that there's been a rapid escalation of abuse complaints. There were only, and I say only 4,000 in 2010, that's still a whole lot. But that skyrocketed to 22,500 in 2018, which is the last year we have that kind of data available for us. And it's our belief this is really based on ageism at the core, because we would never treat our children the way we treat our elders in a lot of respect. There was a lack of political will. The pressure and the education and awareness wasn't happening. And our population's rapidly aging, and we aren't prepared to handle the number of people who are going to need these sort of services down the road. And the long-term care industry has been built on a business model, not a care model. And again, it creates a terrible gap in care. It's not a warehouse, it's care, but we have a ways to go on that front. Amazingly, as we dug into this, Minnesota is the only state not to license assisted living facilities. The only state, a state that considers themselves such a progressive, didn't even regulate these. So as we came together with Elder Voice, that is the issue that we chose to pursue first. It was a huge issue. To be honest, I as I was mentioning to Jane earlier, I'm surprised we achieved what we did, because we had a huge challenge ahead of us. The long-term care industry has, I think, like 47 lobbyists. It hired people to lobby the state legislature. We partnered up with AARP, who has one lobbyist, Legal Aid, who has one lobbyist, Alzheimer's, who has one lobbyist, and us, who know. I'm a former lobbyist, so I know the process, but I've been away from it for quite some time and didn't know the players. But what we had is our members were willing to tell their stories. And that's exactly what we did, because we needed to seek justice for the residents and their families. Long story short, it took us 2 years, but we did get the passage of, it's like 150 some page bill that establishes the assisted living licensure, as well as establishes new protections from maltreatment, from retaliation, etc. This was a happy day when we got our bill signed into law by the governor. And I put this quote from Ron from the Legal Aid organization, and he gave credit to making the difference because of our members willing to tell their stories. And he said they had been trying before that, but just really couldn't get the attention of the legislature until we came about. So what happened is this legislation passed, and it requires two tiers of licensing, one with assisted living and then one with assisted living with memory care. And the reason to split those out is because memory care residents have needs that are far different than the typical assisted living residents. The rule placing then making took place for the following 2 years, and it was to become effective August 1st of this year. Nope, we're already into the next year. Sorry, in 2021. And as the pandemic reared up, the commissioner of the Department of Health called together a few of us advocates and asked and said she's had to redeploy all her staff to handling the pandemic. Therefore, she didn't think they could get the rulemaking done. All the other advocate groups said, okay, we understand. What we said is, we understand and we empathize, but we ask you, please find a way to get it done. The longer we go without that law, the longer we're going to have people needlessly suffering and some even dying from the neglect and abuse. And I give Commissioner Malcolm a lot of kudos for stepping up and redeploying some of her staff to handle the rulemaking. And believe me, I've never gone through rulemaking before, but it's a tedious process, but it's an important process. So it became effective August 1st of 2021. So it's been in place for 6 months now. What it does is it establishes standards for care and staffing. They need to be trained into current practices, current, standard of practices. The nurses and other healthcare professionals must be licensed. And amazingly, they never were allowed to, or they were permitted to not have 24/7 awake staff. And in some cases, there were situations where they would lock the door at night and there would be no staff all night. So that law now is in place. And then also some culturally sensitive programming in place. Now, in addition to all of that, assisted living facility administrators need to be licensed. And the reason for that is because so many of these folks were coming out of the hospitality industry, didn't know a thing about elder care, and it showed. So now at least they have to be educated and trained. Especially on the dementia care, administrators have to have the qualification and ability to care for them. The staffing and training needs to be really focused on the dementia. And we've got long ways to go on that one. And then other special program. Importantly, the assessment by an RN is critically important, and not just when a person enters the facility, but also ongoing, because as we know, things can change with our health pretty quickly. And the reason that's important is without that assessment, you can't really know fully if that specific facility has an ability to meet all your needs. So that has to be done. Also, there are some consumer protections and rights that were put in place and given a few more teeth. Arbitrary termination now has been prohibited. They cannot just all of a sudden say, oh, you spent all your private money, now you're going to go on to a public assistance program, but we don't get paid as much, so you need to go elsewhere. So there's some protections there, not enough, but there's some. And at least there's got to be some planful processes in place. Retaliation is a huge issue. And retaliation happens to the residents, it happens to the family members, and even to the staff. And that's a way of some of these bad facilities are controlling people. So now there are protections, there's laws against it, and we do need to, be mindful of that. Also, electronic monitoring. The industry fought electronic monitoring, or the ability of a family to put a camera in a residence because they didn't want eyes on. And I say I mean the bad operators, because there are good facilities out there too. But the bad operators knew full well that wouldn't go over well. So the only compromise we could get is because we felt the facility doesn't need to know if the family put a camera in or not. And they fought that, but what we've got is at least for the first 2 weeks, a family may put a camera in. They don't have to notify the facility if they're suspecting some sort of neglect or abuse. And these cameras are so important because, first of all, it can be very helpful to the facility, because if you see see something that needs to be addressed, you can call the facility and say, gee, mom just fell. Can you go and check on her, or whatever it might be? So we've been, made progress there. Also, elderly waiver residents have more protections now, and we clearly need to on that front too. But those are some of the key provisions of that new law. And I wish I could say our job is done. It's not. We've got a lot of work to do ahead of us, because this was a good start, but we need to really be vigilant to see how well will these facilities apply these new laws and adhere to them. And so we will go, hold on, there we go. We will be watching that. I want to spend a little time just to talk about the horrendous impact the pandemic has had on nursing home and assisted living residents. Right now, we're at about 50% of all of our deaths in Minnesota are happening in these the nursing homes and assisted living. Yet they're only 1% of all of the population. Yes, they're elderly. Yes, many have health conditions that leave them very vulnerable. But this is a performance far worse than what we see on a national average. And nationally, in the last number I had available to me, 31% of the deaths were happening in these long-term care facilities, compared to, and this was back in June, and compared to that time, we were over 80%. So we've got a huge problem. And of course, like I mentioned, poor infection control has also just made this a hotbed of COVID. And yeah, you've got staff coming and going, sometimes with very lax protective measures like masks and sanitation. And incredibly, we still have a very low staff vaccination rates. And again, we need to work on this. My only regret is that we didn't have this law passed years ago, because I really do believe we would have seen far fewer deaths had that happened. And what is also happening is the tremendous impact it's having on staffing. The long-term care industry is always understaffed. Their facilities. It's such an easy way to manage costs and improve the profitability, is just reduce staff. But the pandemic now has I don't even quadrupled or whatever the impact on the staff. They're getting sick. The demands are getting greater because there's fewer and fewer of them. The industry 3 months ago said there were 23,000 open positions. That's about a quarter of all the positions in long-term care that were vacant, nobody there to fill them. And obviously the impact that this has on quality care is devastating. So one of the drivers of some of this problem is the low pay that the caregivers get in these facilities. And in Minnesota, the livable wage is $52,000. On average, a Minnesota caregiver range, their annual salary is $20,000 to $30,000. So $10 to $15 an hour. And what some of these folks are doing is they're working 2 and sometimes 3 jobs, and they're exhausted, and it's tough. And it's well established, as many reports, that low pay correlates directly with poor care, and it stands to reason. Well, some of the solutions that are being entertained at the legislature, which will start at the end of the month, is essential caregiver bonuses. Those are kind of short-term things. But the American Rescue Plan, there's a lot of dollars available there. And we've yet to see how the governor and then the legislature will divvy up that. But if any of you have a chance to talk to your legislators, I would ask that you advocate that a lot of those dollars go toward the protection of the folks in long-term care. And one of the key ways I would suggest, and I'll talk about this shortly, is get more enforcement resources for the Department of Health. Because if the bad actors, if they don't have somebody overseeing them, they will continue doing their bad practices. And until we have somebody who's actively looking over their shoulders and imposing penalties that make a difference, we're going to see these sort of situations continue. Right now, 1 in 8 direct care workers live in poverty, and 3/4 of them earn less than the average living wage. So we Elder Voice will be pushing for increasing the wage for these folks. We'll also advocate that there be an increase to the facilities in the rates that they pay for Medicare and elderly waiver reimbursement. And 2/3 of the nursing home residents are on Medicaid, and Medicaid underfunds this care by 88 cents on the dollar. We will support this increase in funding to the facilities, but only if there are strong safeguards that make sure the added money goes in large part to the staff, not to the profitability of the long-term care owners. They're making plenty of money. They're building plenty of these places. They of course say, oh, we're having a hard time making things meet. And I do believe there are challenges now, but they wouldn't be on this building spree if there was such a difficult economic environment either. So we need to keep working on that. Now, specifically, Elder Voice we're going to be working on the livable wages for workers. And like I mentioned, the reimbursement rates. Another huge threat out there, I just heard once again that there's probably going to be legislation that would grant legal immunity for the wrongdoing of the long-term care facility operators during the pandemic. That is a significant problem. We fought it and killed it last year. We will do the same. There's so little legal ability for families to pursue as it is without giving them blanket immunity for oftentimes willful mismanagement of their business that really causes serious harm. And we'd also not only increase the funding to the Department of Health, but increase it to the Ombudsman. They are the state entity that's able to intervene and work with the facility and the family when there are problems. And with that, I will wrap it up and then open it up. I see there are a couple of questions in the Q&A, but I think I'll turn it over to you, Jane, and I'd be happy to entertain any questions.
Jane, there you go. Jane, your mic's
Yeah,
not on. There we
I
go.
had to unmute. Yeah, sorry. Oh no, wait, I got to get back. Nancy asked several questions. One of them is, what are the new protections if all one's private money is spent?
And some of this is a problem, and we still have a long ways to go on this issue, and that's going to be a future public policy challenge for us to take on. And Nancy, you go, I see, to ask, for more detailed summary. I put my email address in there. Send me an email, Nancy, and I will send you a more detailed discussion of the new law and its provisions, and especially the protections for when they've spent down their own earnings. It's weak at best. The protections aren't adequate. We need to do more work on that front, I'm sorry to say.
Yeah, and you answered about the law. Tom asks, it is my observation that senior living, assisted living, and nursing home care are three very different programs with different problems and solutions. To date, assisted living as the newest program has gotten the least attention. Is there any work being done to bring assisted living up to speed?
Yes, Tom, your observation is right. And that's why we were pursuing that legislation that just went into effect 6 months ago. And these facilities now have far more stringent requirements of them. And I'll tell you, there was a lot of threats that the industry was making prior to the passage of this law, that they would go out of business. They would not be able to provide this care, the standards of care that we are imposing now through this law. Well, in fact, nearly all of them did register to get licensed. So there wasn't any fallout from that. Now, there could very well be some of the weaker operators that will close their doors. And to that, I guess I'm sorry, but we can't allow subpar operators to give such shoddy care to our folks. So we do have to work on that. And again, with all this new law, it's only as good as the enforcement is. That's my biggest worry right now. That's where we are going to be monitoring these investigations. And we are going to start calling attention to some of the really bad actors out there who are doing horrible things. So we will be expect in a couple of months, and we do have a newsletter, and if any of you want to get on that, please email me. But when what we're planning is to have on our website an ability for somebody to go in and say, okay, I want to know about Sunny Pastures Assisted Living. I just picked that name out of thin air. And they'd be able to go there, and from that, quickly see, has that place been investigated? What were the situations? How was it resolved? As well as some of the survey information. Now, that's not everything you need to know about a facility, but it's a very important piece to put in the mix of your consideration, and if you're having some issues. If you're having specific issues, there's a report and go to our website, because we have some of that available. That'll give you some links to the how to report abuse or neglect and the steps to take, and that, as well as some other resources available to help you deal with some of these situations. So and if there's anything you need to know, just send me an email or respond through the website.
Chris, I have a question. See if I close this up. A lot of us do have family, friends, whatever, elsewhere in the country. Is, like if they're in one particular state, is there a central location, or do we have to get to that state's health department, or how do we start?
Yeah, nothing centralized. Sorry about that. Actually, the Attorney General from Wisconsin told us, "I wish you would replicate yourself in Wisconsin." And we got an investor who said, I'd like to give you some money if you'd replicate yourself in other states. Well, that's nice. It's a big deal to do. So, but yes, I go to their Department of Health, and every state tends to have a AARP organization. And some are pretty good. Some of the states are pretty good, some not so good, but that's another resource that I would suggest, more so than the Alzheimer's Association. They have chapters too all over, but then again, some of them may be very good. So that's another resource. But I'd start with the Department of Health and find out what kind of resources are available. The ombudsman should be available in every state too. So it would be a long-term care ombudsman, and look for that kind of person as well to help you out with a specific problem situation. Does that help a little bit?
It does. Thank you. Yeah. Looking again here. Myra has a question. Thank you, Chris, for your talk. You mentioned ombudsman, whoops, can't say that, for long-term care as an ally. On a couple of different occasions when my family members were in long-term care, I helped start family councils in the nursing homes in which they resided. I am wondering how you see the role of individual family councils in helping improve care.
Myra, thank you. Thank you for bringing that up, because they are critically important. And we would be happy to help anybody who wants to form a family council. And actually, I just talked to our state ombudsman, the director of the program, on Friday, and told her about another state in Connecticut, which has created a family council on the state level. So talk about a powerful idea. So she's going to look into that, and we're going to continue to pursue that. And like everything, some odds ombudsmen that you get are really, really good, excellent, and some not so good. So I hear that a lot too. Well, I tried and I didn't like that person. Yeah, and then I would just it would come to me, and I can see what I can do to work with them. We've done a good job of developing constructive relationships with the Department of Health and with the ombudsman. So sometimes we're able to help get through some of the muck a little bit. So hopefully, but yeah, family councils, and resident councils as well. It's kind of, the resident councils are really the ability for them to do much is kind of driven by the type of residents that they have and the capabilities. Some are really, really on top of it and really have great resident councils, and others, because there's a lot of cognitive issues and things like that. So that's where family councils are, in my opinion, imperative. Thank you for bringing up that question.
And Myra does give credit to the ombudsman for long-term care group, which helped her group start a family council, evidently in that particular home. So that's awesome. A nice experience there. Yeah. I think those are the questions that we have. Oh, Myra's raising her hand. Can you talk, Myra? Let's see.
It says unmute. So do you hear me?
Now we hear you. Yes.
Okay, good. So I've had 3 different family members in care, long-term care. I happen to be a retired registered nurse, so I was very active in their care. And one of them turned out to have enough money to be in a place called English Rose Suites. I'm not sure if Chris is familiar with that, but it's private pay and they're not connected with Medicare. The care in one of it was very good. But somebody said that this law would inhibit those kind of organizations. I'm wondering about that. I should mention that my brother, actually. He first was in another one of these places that's private pay, and they're old mansions basically made into nursing homes. And I can't remember the name of that group. They were horrible. English Rose Suites was good. So how does this law impact on those places?
You know, if they are private pay and assisted living private pay, they have to adhere to the same law. So they're not exempt from that law.
Okay. And that wouldn't wouldn't put them out of business or anything in any way, right? There'd be no reason if they were doing the right thing that it would inhibit them in any way or cramp their.
Not that I am aware of, no. And yeah, so interestingly you bring that up because now that's the second time I've heard that in the last few days. So I'm gonna have to be on top of that issue.
Well, it might be somebody that's just wanting to be negative about your law. Who knows?
Yeah, well, and sometimes they're either just because they don't understand the law well, or it's purposeful or misrepresenting it. So
Yeah.
Yeah, whatever.
Mhm. Okay.
Well, I just have to say from my personal experience, there's always a tension there with the staff if things aren't going right. And yet I just feel so strongly that it's so important to have family popping in, just observing, just being there, and the staff know you're there. And that's just such an important involvement, I think. And
yeah, again, Jane, I'm glad you raised that issue too, because during the pandemic, when families were being locked out, the impact was devastating. The isolation, even in a good facility, the isolation is very debilitating for anybody, and especially those folks. And in the poorly run places, that allowed unheard of neglect and abuse. I'll just give you one little example, and I tell you all this just so you're aware when you're in these situations too. Eyes on and families involved are huge, and you really have to be on. And no, they don't like strong advocates, and everybody's afraid, oh, if I speak out too much, they're going to I'll pay for it one way or another. They'll find a way to do that. Document everything, record whatever you can, and I'm sorry to say, but the bad actors, you need to be that vigilant.
yeah, unfortunately, it's true. Well, Chris, it looks like we're coming to the end of our time. And I just, like one of our members says, imagine a big applause for you.
Thank you.
I remember when we were getting this going, I don't know, 6 months ago, we wondered if you would be at the church or we would be virtual. Here we are, virtual again. So, but really, really appreciate all of your information and your excellent presentation. So thank you so much. I hope you're hearing from some of our question people here.
I love it, and please reach out. I'm happy to help whomever I can.
Great, thank you.
Thank
Well, I
you.
need to tell everybody about next Sunday. Next Sunday, January 23rd, our topic is the positive benefits of plant-based diet eating. And it's in conjunction with our Climate Environmental Justice Committee. And Susie Sorensen will be the speaker, giving us a lot of ideas. And so please join us next week. Thanks for being here today. And we'll hope to see you